I'm going to kick us off with a question, and as we do that, I'm going to ask both Hannah and Rob if you will introduce yourselves too, and just tell us a little bit about your role. So as you talk about that, I'd also love you to tell us about how your organization and what they're doing approaches mental health as it relates to gun violence prevention. So go ahead. Yep, I can start with you, Hannah, and then we'll go to Rob.
So Hannah Wesolowski, I'm with NAMI, the National Alliance on Mental Illness. We are a nonprofit organization that is across the country. We're actually in 650 local communities, and we support, educate, provide awareness, and advocate, which is my role, for people with mental illness and their loved ones. This is a really important topic to us because of the amount of suicide deaths that are conducted with firearms. More than half of all firearm deaths are suicides, and more than half of all suicides are unfortunately completed by firearms. And firearms are obviously quite lethal. They are by far the most lethal form of suicide. And so from NAMI's perspective, our role is, one, we want to make sure that we're providing resources to the community after either a mass violence event or suicide in the community. We're here to provide that support and help with the community trauma. But we also want to encourage help-seeking behavior, and we want to reduce lethal means. So we advocate for policies that really do diminish access to lethal means, and also partner with law enforcement, with health systems and others to distribute information and tools that help families and individuals so that we can reduce suicide deaths.
Good morning, I'm Rob Allen. I serve as President and CEO of Intermountain Health, and we serve the interior West across 6 states, about 620,000 square miles of geography. And our mission is helping people live the healthiest lives possible. And when you think about the topics we're talking about today, it's critical to that journey of living healthy lives. And in the West, I think it was a professor at the University of Nevada, Las Vegas, early 2000s, who dubbed that interior West where we are as the suicide belt. And it's not because there are more attempts of suicide in the population, but it's because there's more access to firearms. And the lethality of that drives a higher rate of death from the suicide attempts. And, you know, suicide often is a cry for help. And unfortunately, if you attempt it with a firearm, most of the time you don't have a chance to get that help. And so we recognize that challenge and wanted to engage with our communities and understand how can we educate better? How can we bring awareness, normalize the discussion, create paths and avenues through that education, through tools and things that we do in the community to create time and space, some distance between that thought of I want to end it to get some help and create space to get that help along the way. And our focus has been there. And we've seen some impact. We're grateful for that, but there's a lot more to do. And many in this room, many across the country are touched by that. I have 3 family members who've died by suicide. Along the way, I've seen the impact on family and people that are left as well as the loss of life, which is unfortunate when that happens.
Thank you. You both have talked about, unfortunately, the suicide trends are not going the way that we would like them. So if you could highlight, what are some of the interventions that you think truly, from your vantage point, are having an impact?
Go first?
Sure, I'll talk about some things we've done. One of the early things that we did was really recognize that the quick access to firearms is a real challenge. So I was shocked when I learned the statistics that over 42% of those who decide at some point in their journey that they've reached a moment of crisis that they want to end it, attempt suicide within 10 minutes. And over 70% attempt it within 3 hours. And that was really an interesting statistic to start to see and look at from the perspective of how can you actually make a difference. And we learned quickly that if we can create time and distance between access to a firearm, you can save a lot of lives. And so we started handing out locks, just gun locks, saying, you know, in the West where we are, it's a gun culture, and we have some of the highest ownership rates of firearms in the country in that area. So how do you make sure they're secure? And when you start talking with people about the safety of their children, there is a great desire, you know, to help and do what's needed to be done. We've given out nearly 70,000 gun locks to people. Those gun locks get, you know, used in many cases. Now, sometimes people take them and don't use them, but we're finding a lot of use. People take them because they want. We're doing them. We're giving them out in places that are just normal, common, day-to-day places. So we hand them out, you know, tire stores. We hand them out to libraries. We hand them out at gatherings, community gatherings, where people are together in a normal setting, and we see people interested in it and trying to understand, and they're learning along the way. And that's made a huge difference in just creating that space. One of the stories that we heard that I just love the story, it was a Vietnam vet who was dealing with some of that post-crisis depression that happens so often to our military folks who've been engaged in combat and they come home. And he knew that he was at risk himself. He took a gun lock and he put it on his weapon. And he not only did that, but he put a picture of his family on that lock. And there was a point where he came to where he was going to go get his firearm and end it. And he went and got the firearm. And of course, having to take the lock off does create a little bit of time, but of course he had access to take that off. But he picked that up and looked at the picture of his family. It made him stop and think about the impact on them. That saved his life. He backed away, he sought help, he reached out and got some help along the way, got back on his feet, got settled, and went on to do great things, one of which is he's cared for over a dozen kids that are at risk. And getting himself back in line where he was solid, then he could help others. And it's brought meaning to his life. And I think those things are really important, that not only do we save a life, but we create opportunity for people who are then committed to help others. And that is a powerful thing. And we're excited to see that. One other thing that we've done that I think has had great impact is when the Super Bowl was held in Las Vegas, we have a relationship with the Las Vegas Raiders. And we partnered with a number of organizations. And the week before the Super Bowl, we were able to host a event with NFL players, current and past players, who got on a stage in the convention center with a packed hall of students. And to watch these football players who we view as indestructible talk about their mental health journeys. It was fascinating. I don't think there was a dry eye in the room as people came to understand everybody has struggles at some point. And normalizing that discussion, bringing it out, allows us to talk about how we help each other. And the title of that was, the best play is to ask for help. And just get help along the way when you need it. And do that rather than get to the breaking point where you do something that you regret or those around you have to deal with for the rest of their lives. And we found good impact from doing those types of things, just trying to meet people where they are and have the discussion.
Thanks, Rob.
That's incredible stories, and kudos to you all for prioritizing distributing gun locks. Safe storage laws are becoming more prevalent, not prevalent enough. Partnering with community organizations to make sure that gun locks and other safe storage tools and education about safe storage is so important. That's something NAMI has really started to focus on in the last few years. We know that there are almost 5 million kids in this country who live in homes that have firearms and are not safely stored. If we increase safe storage practices in just 20% of those households, we could bring unintentional and suicide firearm deaths in youth down by about a third. Just in 20% of those households. It's a huge impact. So we have the potential to do more there by making it easy and educating families. And I encourage anyone in this room, to partner with groups like NAMI, partner with other groups so that we can get information out to the community. September Suicide Prevention Month, the second Tuesday in September is Firearm Suicide Prevention Day. I think it's September 8th this year. And it's a great opportunity to increase education and, being a mental health organization, providing support, getting that education and those resources, making sure people have access to gun locks is absolutely critical. I would also encourage people to make sure that you are communicating frequently about resources like 988, the 988 Suicide and Crisis Lifeline. Hopefully you all know about that. But as we talk about suicides, it's really important that in that moment, as you said, that moment where somebody is feeling suicidal, that they have a resource to talk to, and 988 provides that, and it's available 24/7.
Great, thank you, and thanks for highlighting 988. When you think about collaboration, and that's what's in this room, and those that are with us online, it really is what is moving the needle. But when you think about that, what are some things that are going to make that successful, either from the health system perspective or from the communities and all the nonprofits that are involved in this? What are some things that are making it successful or that are making it fail?
Partnership is absolutely critical. We know that having health providers involved in these conversations is important. Extreme risk protection orders, when they're developed around real risk factors of violence either to self or to others, have made a big difference when they're utilized. The thing is, most people don't know about them. They don't know how to pursue that if they're worried about a loved one. Health practitioners are an important part of that conversation as well. So I think 22 states have extreme risk protection order laws on the books, but they're not utilized to the extent that they could be. So finding partnerships where we can actually communicate and talk to at-risk communities about what resources are available, where to get gun locks, really advocating for some of those solutions, I think makes a big difference. We have some of our local NAMIs who are, serving as a place where they are partnering with groups to hand out those gun locks, to provide education and counseling about what it can do. And I think we don't leverage all of those community resources enough to increase education and resources.
I think one of the important things here, it is with so many things, but in this case, partnering allows us to really better meet people where they are. And we're not everywhere in our health system. We're a fairly good-sized health system, but there are so many organizations, so many people with direct interest in certain components that can create the space and the opportunity to meet people where they are. And I think that's the most critical thing. One of the things I worry most about with this work that we're doing is that it becomes politicized. And that, it would be a shame. We saw what happened during the pandemic when it became politicized, and that should never be. This is about touching lives. This is about saving lives in all the forms of challenge that happen in this journey as we talk about firearms and gun safety and all of those things, whether it's intended violence, whether it's self-harm, whether it's accidental. We need to be able to touch people where they're at and open that dialogue. And one of the things that we learned in the process in the West is how we talk about it matters. And it's the case in every one of your communities. There are different terminologies, there are different ways to talk about it, and if you can get that first conversation going without a wall going up, you can make real progress. And partnerships allow us to understand that, allow us to meet people in a trusted space where you can have the real discussion and make real impact with that. And it's one of the things we've really tried to focus on and try and recognize that even when we learn from each other, we may not be able to take what you do and apply it directly or vice versa, but we can take what you do, learn from it, and figure out how to connect it in a real meaningful way. And I love the Agree to Agree campaign that we've got, because I think that opens the door and allows you those opportunities from the perspective of the people you're trying to reach. And partnership is key to our success so far and will be critical to our success in tackling this fully.
And if I could just quickly add to that, how we talk about gun violence is really important, and particularly in the wake of mass violence events, mental illness is pulled into that conversation. And it's true, we have a mental health crisis in this country and we have a gun violence crisis in this country, but the solutions are not one and the same. And we need to make sure we're encouraging people to seek help. And when we say, well, that person was crazy, that person clearly had mental illness, we're discouraging people who might be struggling from seeking care. So it's really important to, as you said, meet people where they are and make sure that in our response, we're not discriminating against any group of people, and we're not creating so much stigma that people are afraid to get help.
Thank you for that. So before we go to Q&A with everyone here, the question that I would ask both of you from early lessons or results or this work, what gives you optimism?
Do you want to go first?
Sure. We see progress already. That should give us great optimism. The future of our country are our children, and in this case, we're always talking about our children in this process. And when I see groups like this that come together, it matters. The strength, the energy, the power that comes out of locking arms in the journey gives me great optimism, and I'm excited about what's ahead. I'm excited about what we've accomplished already, by the way. Thank you for the work each of you have done. But I'm excited where we're going to take this further and impact and save more lives.
Yeah, I think the conversation has really evolved in the last few years to focus on the true causes of gun violence, as shown by all of you in this room and what you're working on. And so I'm really encouraged that we've made progress in passing more safe storage laws, that we've made progress in passing more firearm purchase waiting periods, again, to help people get past that moment of suicidal ideation. All of those things make a difference, and from our previous panel, in the states, that's where things are happening. If things aren't happening at the federal level, which they aren't, at the state level and in the communities is where we have a lot of hope and opportunity, and a lot is happening locally already. So I'm very encouraged by that.
Great. All right, I'm going to shift the conversation now. We'll go to Q&A. So a question coming in from Stephanie from Colorado. Says, suicide prevention requires cultural competency to be effective. How can we ensure community members from different cultural and religious backgrounds feel included in conversations around suicide prevention, especially given how shame and stigma can create barriers?
That's a huge part of this conversation. And unfortunately, cultural competency and inclusion have become dirty words in this environment. We need to keep up the conversation to make sure, one, that we have providers that represent their community, but that we're not looking at one-size-fits-all solutions either. I mean, when we look at the rate of youth suicide deaths, Black youth firearm suicide deaths have tripled over the last decade and have now surpassed white youth firearm suicide deaths. It's deeply concerning, and we need to make sure that any solution brings the right folks to the table. In the mental health community, we've long advocated for bringing law enforcement, mental health providers, healthcare providers, advocates together to talk about what does the system look like and where are the gaps. And it's really important that those conversations represent the people that are actually in the community.
I think giving people tools is a starting point. And so part of the education we've really focused on is training around calm, not only our clinicians, but into our communities, teachers and others. And that's counseling about lethal means, also QPR, how to, question, persuade, refer. And when you give people tools, then I think those who are actually connected to those groups can help us figure out how to actually apply those tools. Once you have those in your hand, you can understand, how do I connect with the people I'm trying to connect with more too? And I think that's an important part of the cultural sensitivity, is train broad groups and then let those who are connected to each of those subgroups, so to speak, actually teach us, but at the same time, translate that in a way that's meaningful. And I think that's powerful. So we need to get something out in their hands to start that dialogue and to start that engagement. And we're finding success in teaching those tools across our communities, and much more to do, obviously, but every step matters.
All right, I've got another question coming in. It says, how do child access prevention laws and associated cases like the recent verdict in Georgia change the conversation around safe firearm ownership and parental roles in protecting young people struggling with mental health crisis?
Yeah, I mean, the verdict in Georgia, I think, is a turning point and responsibility for how families look at firearms storage and firearms in their house. So I think this is really kind of turning the tide and seeing so many states pass laws about child access to firearms. We have a real opportunity to try to spread that nationwide, but I think the biggest argument continues to be we need to protect our kids, right? We need to make sure our kids are safe. I think that over legal culpability is going to be the winning argument, and a lot of that really depends on educating parents who may not know. And so pediatricians have played an incredible role in educating many parents across the country, and I hope that continues to make sure that they understand what safe storage means and how to do it, and then giving them, much like you all, the tools to be able to store firearms safely.
Rob, I would just have maybe one closing question for you. With this work, we've talked about stigma as a big barrier. How have you seen this work have an impact even at Intermountain or the conversation we're having there with our caregivers?
Yeah, you've got to find some space to be able to talk about it, right? So you have to normalize. And I think the conversations we're having here, the education that we've been doing, handing out locks, just creating space to open a dialogue starts to normalize the discussion. Then you can get to the real core of what's really there. And it's interesting. Obviously, I've been involved with this now for a few years. But this last year, I was visiting my grandson, 11-year-old, in St. Louis. And unprompted, he just started talking about the training they had at school to, preparation in case there was an attack on the school and gun violence happening there. He was quite distraught about it. And it was just interesting for me to see his anxiety, listen to him, be able to just kind of walk through what was on his mind and recognize this is prevalent across the minds of our kids, and we've got to, at our level, talk about it more and create space to talk about it. And I think just starting that dialogue has happened. Every time there's some publicity of Intermountain being involved in these discussions, we get emails from our caregivers and from our community saying thank you. Yeah. I wondered how much mixed reaction we would get. I have gotten zero communications pushing back on our involvement here, and nothing but personal stories about this happened in my life, this happened to my kids, this happened to my neighbors. Thank you for being there to start this discussion and to help us figure out how to solve it. And I think just opening the dialogue brings a lot of strength out of our community that allows us to get this going even faster and deeper in our communities.
Great. Well, on behalf of all of us, thank you so much for the work that you do and being here with us today. Thank you so much. Megan.